Hi, I'm Dr. Alex Summers. I'm the Medical Officer of Health at the Middlesex-London Health Unit. There's lots of measles conversations happening in our community as we watch outbreaks in some of our surrounding communities and in our surrounding neighbors. We've really appreciated all the questions that have come in through all of our social media networks, and we're going to take some time for me to answer some of those questions so that we can give you the answers that you need. Okay, so our first question submitted is asked, what is measles? What's going on here? Well, measles is a very contagious virus, and it spreads really quickly. In fact, if somebody is sick with measles, 9 out of 10 people who are nearby will become sick with the virus if they're susceptible to it. Okay, question number 2. Ways to protect yourself from measles. Well, there's one really simple and quick answer to that. Get yourself vaccinated. The vaccine for measles, mumps, and rubella is one of the most effective vaccines that we have. One dose of a measles-containing vaccine is up to 93% effective at getting infected with that virus. You get 2 doses, 97% or more effective in preventing infection. That's the #1 way you can get protected. In Canada, we've had the MMR vaccine around for many, many years, so lots of us are fully protected, but now's the time to make sure that you're protected, given that we're seeing transmission in our community. Next question. What are the symptoms of measles? Great question. So the symptom of measles most commonly are identified by a rash that can start on the face and then move on to the rest of the body. It's associated with a high fever, red or itchy eyes, and a runny nose as well. Those are the most common presenting symptoms. People can get even sicker, especially if they're more vulnerable to this virus, and can get things like diarrhea or pneumonia, which is an infection of the lungs, or in worst case scenarios, can end up with an infection of the brain called encephalitis. Okay, next question. What do I do if I feel sick or think that I have measles? Well, the first thing to do if you feel unwell is to make sure that you stay home to protect others. Of course, if you're really sick and you need some medical attention, you need to call ahead to your healthcare provider, or if you need to go into hospital, call ahead to let them know so that they can put the infection prevention practices in place to make sure that you don't spread measles to other people if that is in fact what you have. So if you, all right, next question. How do I know if I am immune to measles? Well, there's a few ways to know. If you were born before 1970, we actually consider you to be immune to measles because we didn't have a vaccine before then, and measles transmitted quite readily and quite quickly in Canada. So if you're born before 1970, you would have had measles, which means you have immunity. If you're born after 1970, you need to have had 2 doses of a measles-containing vaccine. If you only have 1 dose, make sure you visit your healthcare provider to get that 2nd dose. And if you don't know your vaccination history, it's worthwhile to visit your healthcare provider to get a dose of measles-containing vaccine in order to give you that protection moving forward. Should I get my child vaccinated early? Well, this is one of the most common questions that we're receiving right now, and fair enough. With all the outbreaks that are happening in southwestern Ontario, parents are rightly asking, am I doing enough to protect my child? And that's a fair question. In some of our neighboring jurisdictions where outbreaks of measles are occurring, there are some recommendations for people to get their child vaccinated a little bit earlier. In Middlesex-London, we're not currently in outbreak, so that guidance doesn't apply as of yet, and you can continue to follow the routine vaccination schedule. Typically, a child receives a measles-containing vaccine at 1 year of age and a 2nd dose between the ages of 4 and 6. Those 2 doses provide that lifelong immunity that we want. There are reasons that a child might receive a vaccine between 6 months of age and 11 months of age, and that would be if they're living in higher risk areas. In Middlesex-London, that's not currently the case. However, if you do travel routinely to those high-risk areas that are currently in outbreak, it is reasonable to consider getting your child vaccinated early. If you provide them a vaccine between 6 months and 11 months of age, you then have to provide an additional 2 vaccine doses after they are 1 year of age. And the reason for that is that the first dose doesn't necessarily provide the lifelong immunity that we want to see if it's given before the age of 12 months. If your child has received 1 dose already and they're just not yet 4 years of age, you can consider giving them that 2nd dose early if you're traveling to higher risk areas. And if that's the case, you don't have to give them another dose later on. They will have that lifelong protection. I don't know whether I've had 2 doses of measles-containing vaccine. How do I find out? So there's a few ways that you can try and find out if you've had a measles-containing vaccine before. The first thing is to follow up with your healthcare provider to see if they have any doses on record at their office. You can also follow up with your previous healthcare providers, your childhood family doctor as an example, to see if they have any records available for you. Once you've tried all those avenues, then it's important to go and get a dose of measles-containing vaccine if you don't have any records of having one previously. Some people have asked us, if I don't have any records of vaccine, should I just go get some blood work to see if I'm immune? And we recommend against that generally. The most important thing for you to do is to go and get a vaccine if you don't know what your records are. Getting an extra dose, even if you've previously had 2 doses and you just didn't know it, isn't going to harm you. It'll just make sure that you are up to date. What's the difference between an exposure to measles, a measles case, and an outbreak of measles? Great question. I'll start with what's a case of measles. Well, when we say that we've had a case of measles in Middlesex-London, what we're talking about is that someone who lives or works or studies in our region has been diagnosed with measles. When we talk about somebody being exposed to measles, what we mean is that someone has been close to somebody who's been infected to measles and therefore is at risk of being infected. When we talk about an outbreak of measles, that's when we mean that we're seeing transmission in our region from person to person, suggesting that measles is actually transmitting amongst our population. So currently in the Middlesex-London region, we have seen lots of exposures from people who have measles who live outside of Middlesex-London. We've had one case of somebody who lives in Middlesex-London who has been diagnosed with measles, and we have not seen conditions to suggest that we're in outbreak. We continue to monitor this, and we will tell the community if that changes. Why hasn't the health unit mandated these vaccines? That's a really important question and a really complicated question, and it's one that we get asked relatively routinely. Mandating somebody to do something that they don't want to do is a big deal. And mandating vaccines are a big deal as well. And we saw and talked about this quite a lot through the COVID-19 pandemic. There are times, rarely, where for the good of the community and for the good of all of us, it's important for all of us to do our part. And frankly, that's always the case, and particularly for measles. Vaccination is one of the key ways in which we follow through on our civic duty. It's doing something not only for ourselves, but for others. But mandating vaccine kind of goes beyond that. It's beyond that civic call to say you have to. And that's a really big deal. The power to make that decision actually lies with our elected officials, because they're the ones who we vote to make decisions about what we require others to do on behalf of our community broadly. So we're not going to be mandating vaccines as a health unit. It does not mean that we won't strongly encourage vaccination always, and that we won't tell you about how safe and effective these vaccines are. But mandating vaccines is a big deal, and we only do that in once-in-a-lifetime scenarios like the pandemic, and that requires the involvement of our elected officials who rightly have the authority and the responsibility for making those really tough decisions. Thanks for all those wonderful questions. Measles is back, and that's really scary. I think for many of us, we're kind of surprised that we have to be talking about measles in 2025 when we've had a vaccine that's been so readily available for us and to us for so long. To me, this outbreak is a reminder of how critical it is to stay on top of our vaccines. And in Middlesex-London, we're really fortunate. We've got high vaccination coverage for the measles, mumps, and rubella vaccine amongst our children and amongst our population. And that's one of the reasons why we're not seeing transmission in our jurisdiction. But it's up to all of us to do our part. Check your vaccination records. Follow up with your family doctor to see if you've received all the doses. And if you haven't, or if you're not sure, make sure you're up to date. That's how you protect yourself, and it's critically how you protect those around us who can't get vaccinated, those who are too young or who've got medical conditions that don't allow for them to get vaccinated with this vaccine. We all play a part in protecting ourselves from infectious diseases. Thank you for everything that you do to protect one another, and thanks for these questions. We're your local health unit, and we're happy to support you through this. If you have any further questions, don't hesitate to reach out.